pandemic really made evident certain problems in our healthcare systems.
Movilización de respiradores, la utilización de nuestros recursos. Había una gran demanda de médicos hacia el área de terapia intensiva, mucha gente muriendo.
The pandemic has taken a major toll on the mental health of the medical workers too.
For many doctors and nurses, the emotional wounds of COVID-19 run deep.
We don't take care of the mental health and well-being of the healthcare provider.
A survey found emotional conditions comparable to a war zone.
Depression, anxiety, PTSD.
Yo estaba pasando por varias situaciones muy difíciles. Estuve yendo a varias cosas, mas no llenaban esa ansiedad o esa angustia.
Y encontramos otra pandemia, una pandemia de salud mental.
It's interesting that such a stressful and difficult profession like being a healthcare professional, that they don't have explicit training on how to manage their emotions, how to manage their stress, how to manage interpersonal relationships, even though now we have so much science showing that we can train these skills. The underlying assumption of everything that we're doing in this project is that to the extent that we can develop certain character strength or skills, this should improve mental health and well-being. If you have these skills, your mind is calmer, kinder, and clearer, and you have a deeper sense of purpose with a deeper sense of altruistic intention to help others. Everything that we teach in the Integrated Stress Toolbox have been scientifically validated to work with stress. For example, breath awareness is a really good way of learning to calm down and regulate emotions. And that's why we teach it. You don't need anything other than just making a pause for a moment and going to your breath.
Es una estrategia que quedó muy impregnado entre los chicos y entre nosotros. Fue parar. Parar con esta disminución de toda esta turbulencia mental, hacer estos espacios de parar.
Y ahora detente ahí, brazos arriba, inhala. Y exhala. Suelta, manos al abdomen, cierra los ojos tantito, observa cómo te sientes. Después de esta pausa activa.
Al enfrentarnos a una condición de una muerte o dar una mala noticia, lo que hacíamos era parar y eso ayudaba muchísimo a calmar.
Era las serpientes, la mente de chango, el calmarme, el tomar la responsabilidad de mis emociones y el hecho de decir, sí puedo y lo estoy logrando.
The way you train your mind is that you use pretty much every single opportunity that you have to actually practice explicitly and intentionally practice these skills. Let's take the example of empathy, right? So, what is empathy? How do we define it? Why it might be important?
La empatía se considera a atender completamente a una persona de forma bondadosa.
We have two techniques to teach empathy. First is to put in the shoes of the other.
So, for example, you put yourself in someone else's shoes and you do that consistently, and then you do it with someone, for example, that you like and someone a little bit more difficult to you, and then you keep on training in such a way that little by little you develop the skill.
We teach also how to listen actively when other people is talking to us. If we can build that capacity of listen, we can put in the shoes of the other.
Yo me puse a observar a mis compañeros. Me enseñé a veces a ponerme en sus zapatos o a sentir empatía por lo que ellos estaban pasando. Yo normalmente no interactuaba con ellos. Me he dado cuenta que actualmente interactúo con casi todo el personal. Y no es que la dinámica del trabajo haya cambiado, que lo que esto ha pasado es que yo estoy cambiando, que yo he cambiado.
When we start to study this very long career, we want to help. It's the common thing. And we forgot that in the way.
There's an exploration of, what is it that I value the most? What are my deeper yearnings? And then seeing how everything that we do can be aligned. Just being with a patient or being in a meeting, that can be integrated or aligned with your deeper sense of purpose.
Entonces, por eso, cuando aparecen estas herramientas, no solamente vino como a ser un bálsamo, y concretamente, este programa nos ha servido para tener dentro del escenario hospitalario una posibilidad de disminuir no solamente la angustia.
Bring some awareness to the sensations in your body, to how you actually feel right now, in this moment.
Los problemas están ahí todo el tiempo, pero la manera en que nuestro equipo ha estado impactándose con estos mismos problemas.
So far, we've reached around 5,000 healthcare providers in Mexico. So there's consistent reductions in depression, anxiety, burnout, and stress.
Esto que han ustedes transmitido a nosotros, un giro total para nuestras vidas, nos alimenta, nos fortalece y nos invita a seguir. Muchas gracias de verdad.
Without the support of the Templeton World Charity Foundation, we couldn't do this. We had to do a very robust scientific proposal, and now we're getting the support to do this. It's incredibly meaningful. We're going to give the intervention to the treatment group and collect data both for the treatment and the control. This comparison will allow us to see causality for our intervention. And we really envision that hopefully within the next 5 to 10 years, medical schools throughout Mexico and hopefully Latin America and the States will have a course saying how to manage your emotions and your personal relationships, how to be kinder, how to keep your empathy and compassion alive.
¿Cómo ha impactado en mí el programa? Para mí ha sido aprender y sigo aprendiendo a estas alturas de mi vida a tomar las riendas de mi vida. Y agradezco muchísimo la oportunidad que me han dado para poder estar en este programa.
If you feel well, if you feel happy, you can flourish. If your energy is just in the stressful life that you have, you don't flourish. This program can be the way to the flourishing of people.
Ya ahora estoy más tranquilo, más controlado y pienso mejor, veo mejor las cosas más claras.
I feel that the time is ripe to protect and secure the mental health of healthcare providers. So working steadily and strongly in that direction really excites me. In a way, I think that has been catalyzed by the pandemic, that we've seen that mental health and the skills to secure that mental health and well-being is something we cannot do without.